Bacteria that is not properly removed will multiply and trigger periodontal disease, which begins as gum inflammation, redness, and bleeding while brushing and flossing. If left untreated, over time, gum inflammation will progress to chronic infection, soft tissue damage, receding gums, periodontal pockets, bone loss, and eventually tooth loss. These conditions can lead to painful repair and maintenance in the future, which could amount to thousands of dollars in expense and countless hours in the dentist's chair. Problems in the oral cavity are best treated in the early stages.
A periodontally healthy mouth has pink, uninflamed gingival and no bone loss. Left untreated, periodontal disease will advance from gingivitis, which is an inflammatory disease of the gums and can be treated easily, to periodontitis, which begins to break down the supporting bone of the teeth, to advanced periodontitis, where much of the bone around the teeth is destroyed and mobility occurs. This process is slow to progress and takes years to advance. It is imperative to catch the disease early and to treat it before bone loss can affect the viability of the teeth. Using radiographs and periodontal probes, your dentist will be able to determine the extent of the problem. A perio charting will be completed, which will identify any problem areas. Your dentist will then begin a treatment plan. Periodontal disease is caused by bacteria which live in soft plaque, calculus, or tartar. In order to eliminate periodontal disease, it is imperative to remove the calculus on the tooth surface and the root. While treating early periodontal disease may require simple visits of scaling and root planing, more advanced cases may require surgical intervention to maintain the viability of the teeth.
Periodontal disease is caused by bacteria that live in the mouth. The bacteria can cause an infection of the gums that leads to bleeding and swelling and can eventually destroy the supporting bone around the teeth. As the disease advances, the teeth become loose and may be lost. Periodontal disease may be prevented by proper oral hygiene and regular dental visits.
What are some tips to improve my gum health? If you want healthy gums for a lifetime, you have to start now. The most common cause of diseased gums is dental plaque. To keep ahead of plaque buildup, combine daily hygiene with regular professional cleanings. Brushing twice a day and flossing every night before bed slows the accumulation of hard-to-remove plaque. In addition, periodic professional cleanings remove the stubborn plaque that may remain. Typically, patients should visit their dentist every 6 months. However, you may be recommended for more frequent appointments if you're experiencing periodontal disease. Next steps. Do you have swollen gums? You can start improving the condition of your gums today by improving your brushing and flossing habits at home. Also, if you have not seen your dentist or dental hygienist in over 6 months, schedule a visit online or give us a call today. Why are my gums swollen? Swollen gums are never normal or healthy. If you consistently see red, puffy gums when you brush your teeth, do not assume they will get better on their own. The name for this inflammation in the gums is gingivitis, and it is commonly caused by the growth of bacterial toxins produced by inadequately removing dental plaque from our teeth. What is periodontal disease? Periodontal disease is when acute gingivitis becomes a chronic condition. Swollen gums are not always associated with periodontal disease, but it is a warning sign that you should see a dentist and undergo a periodontal evaluation right away. Periodontal disease is not a disease that only affects the mouth. Researchers have linked active periodontal disease with systemic health conditions like cardiovascular disease, diabetes, and Alzheimer's. Studies show that people with chronic gum disease have a much higher risk for suffering from heart attacks and strokes than those with healthy gums.
Recession is a serious dental condition that can require surgery to repair. Essentially, recession is the root exposure of the teeth usually seen on the front of the teeth where the bone is thinnest. There are many causes for recession, but the main cause is bone loss on the front of the tooth. This can be seen from clinching and grinding of teeth. This abnormal oral movement causes the bone to strip up the root of the tooth. The gums recede until they reach healthy bone. Another cause can even be orthodontics. Again, the movement of the teeth can cause the bone to resorb. The most common way to lose bone is through gum disease. Here, the bone is usually lost horizontally. Surgery to rectify the infection is a lowering of the gums to a healthy level, leaving the roots exposed. It has been thought that aggressive brushing causes recession, but the main cause is bone loss. Recession causes a whole host of problems. They can be as minor as tooth sensitivity to as extensive as tooth loss. Enamel protects the outside of the tooth. The gums protect the roots. If there is recession, the roots become exposed. The sensitivity to sweets and cold can become severely uncomfortable. These exposed roots can also become more prone to decay, causing the need of costly dental procedures. It is important to recognize this problem before it requires costly surgery. Ask your dentist what you can do to halt recession and keep your dental health at its best.
When a patient exhibits gum recession or deficient thickness, a soft tissue graft can be performed. An appropriate sized piece of tissue is harvested from the palate and transplanted to the recipient site.